The Coordinating Minister of Health and Social Welfare, Professor Ali Pate, says over 16,000 Nigerian doctors have left the country in the last 5 to 7 years to seek greener pastures in other countries. The minister disclosed this at the 7th Annual Capacity Building Workshop of the Association of Medical Councils of Africa. Professor Pate also says the doctor-to-population ratio is now 3.9%. That's per 10,000 in the country, while the estimated cost of training one medical doctor exceeds $21,000. He laments that nurses and midwives who left have also thinned the number of healthcare workers in the country. He, however, emphasized that the phenomenon offers an opportunity to rethink and reshape the policies to manage the valuable health workforce in ways that benefit our countries first and foremost. That's talking about Nigeria.
The crisis of health professionals migration from developing countries is not new, but it has accelerated in recent years. In Nigeria alone, over 16,000 doctors are estimated to have left the country in the last 5 to 7 years, with thousands more exiting in the last few years alone. Nurses and midwives have also thinned numbers, and the doctor-to-population ratio now hovers around 3.9 per 10,000, below the suggested minimum.
Well, I'm joined now by the Minister of State for Health, Dr. Isiaq Salako. Thank you very much for joining us on Newsnight. Well, when you hear this alarm raised by the Minister of Health, that's 16,000 Nigerian doctors, and I wonder exactly how many medical doctors do we have in Nigeria, because the books are saying around 55,000 licensed doctors in the country. If that's really the number, and 16,000 have, left the country, does it mean nothing much has changed, since 2 years that you all have been in the saddle in the health ministry to not only retain health workers, medical doctors, but also to bring back those who've left?
Thank you very much, and good evening, Nigerians. A lot has really changed, some positive. For the first time, this government recognizing the challenge with respect to the migration of health workers. The government came up with a national policy on health workers migration. And that policy is out to address the pull and push factors around the migration. Research has shown that 80% of people that are leaving because of economic reasons. So, as a result, we have a package. The policy also focuses on incentives to retain. Incentives in terms of, not just in terms of salary, in terms of access to mortgage, for example, access to credit facilities, to own vehicles, to own equipments, insurance provision to ring-fence practitioners, some special allowances especially for health workers working in the rural areas, and also increasing the retirement age of clinical health workers so that we can still get a lot more within the space. Beyond that, there's also a deliberate policy to continuously interface with Nigerian health professionals outside the country. So we now have a director handling diaspora affairs who reports to the Minister of State for Health through the permanent secretary. So through that, we're also able to interface, harvest the contribution of Nigerian health professionals outside the country. About less than a month ago, I was in the UK to participate in the UK African Health Summit in which a lot of Nigerians participated, and it was an opportunity to interface with them, to talk with them, to get them to see some of the things that is happening at home, and also get them to come around to participate. At the moment, as I'm talking to you, the Association of Nigerian Physicians in America are in Lagos doing their 38th anniversary, and they're also doing outreaches. So this is a deliberate approach to ensure that we're not just looking at migration as a negative issue, we're also looking at the positive side of it in terms of the exposure that is given to Nigerian practitioners and harvesting those experiences to contribute to the development of the healthcare sector.
Yeah, but it's not a deliberate policy, really, on the part of the health handlers, the health ministry, to, you know, factor in the positive side that you have just talked about. In Cuba, for example, they train medical doctors and send them, you know, abroad. In the Philippines, too, they train nurses and take them out, you know, to not only earn forex for the countries, but, you know, to gain, you know, added knowledge. Let's talk more about this national...
It's important to say,
yes, very quickly, yeah.
That is another very important area that the government has addressed. You will see that in the last 2 years, we have increased the capacity of our health training institutions by about 100% in terms of the intakes and, of course, subsequent outputs that...
Where was it when you met it, and what's the figure now?
Well, I do not have the figures on the tips of my hands, but the policy was that each health training institution should increase by at least 50%, and that is being implemented across board for nurses, for doctors, laboratory scientists, pharmacists, and so on and so forth. So that is being implemented across the board.
Okay, that's quite interesting. But have you been able to, you know, carry out research on what this medical JACPA is doing to Nigeria's health sector? And what practical moves are you really making? Beyond the policy, I mean, it's just written on paper. But in terms of implementation,
I can assure you that in terms of implementation, this is ongoing. Of course, the practical example is what I've just told you in terms of the Association of Nigerian Physicians in America. That's a practical demonstration of the interface that we're doing with Nigerian.
No, I'm talking about the gap that this 16,000 has created. I mean,
Yes,
can you paint a picture for us in terms of what it has done to our health sector?
No, clearly the government recognizes that it's a problem.
Right.
And that's why there's a deliberate policy to address it, you know. And a practical initiative is, for example, increasing the output. Of course, that's not going to happen overnight. Right. One other practical intervention is now to harvest contribution through use of technology, using telemedicine. People can consult virtually. People can contribute without being physically present. You know, that is another practical example of what we're doing.
Is there a timeline for this national policy on health workforce migration for it to take off?
No, the policy is already being implemented.
It's already being implemented?
It's already being implemented,
okay.
Yes. It's already being implemented in terms of, for example, the 65 years extension of retirement age for health workers is already a policy of government that's already been implemented.
So what are you doing about increasing or improving the doctor to population ratio from 3.9 per 10,000 that it is now?
Right. The fact of the matter is that for us to turn out enough doctors will take some time. Doctors cannot be produced overnight, or any health worker for that matter. You know, so it takes a while. It takes a while for that to happen. But government has recognized that challenge and has taken steps in terms of increasing the capacity of our training institutions to turn out more workers, and also turning health workers migration to health workers exporting, looking at the business side of it, and also deliberately instituting mechanism to ensure that there's a bilateral agreement between countries like Nigeria that are source countries and destination countries to have enforceable bilateral agreements, so that, just like the coordinating minister said, Nigeria expends a lot of money to train health workers. For a doctor, as an example, takes about 21,000. That's a lot of money, you know. So when such resources goes out of the country, they are resources of the country, and they cannot go without Nigeria also benefiting one way or the other.
Is there any deliberate policy to get young Nigerians to opt for, to read medicine, to study medicine?
No, see, clearly that Nigeria has a policy. Yes, Nigeria has a policy to emphasize science and technical education. That is.
Are there incentives? That's my question.
Yes, there are, because you see, if you compare, for example, what an average person pay in a public school to read medicine and what he has to pay maybe in a private school to read medicine, you see the gap. Government is subsidizing significantly the education of people who goes to read health related courses. And if you even compare it to what it costs to be a doctor, to be a nurse outside the country, in Europe, America, you also see a significant gap. So that delivery policy is to help. And if you also look at the policy of the admission authorities like JAM, you will see an emphasis around science and technical education to ensure that Nigeria increase the capacity not only in health but also in technological space.
All right, it will be nice to have you back again and see how far this national policy on health workforce migration has succeeded. Thank you very much for joining us. Dr. Isiaq Salako is Minister of State for Health.